Hello, everybody. It's a great honour to be here, and thank the organisers very much indeed for inviting me. I'm just going to see if I can get these buttons right. I've had funding from a number of different agencies in England for research that's broadly in this field, and I forgot to put one on the slide, which is the Health Foundation, and that's for research around communication and how you can help families communicate. I want to extend my thanks particularly to Conrad and Michelle and the rest of the team for all the enormous help that I and I know others received in preparing this paper, and I've hugely enjoyed putting this together. And I think it says something about the elusive nature of expertise, that this is something I've worked on over many years, but it's always just ahead of you, your understanding. And this has really helped, I think, me to understand some of the issues in this field. I also want to thank my colleagues in England who have helped in a systematic review of this subject, which was published in 2009. So this is the question that we're looking at now in this session. And just to give you an overview, I'm going to give you a brief context and then give you some examples of campaigns internationally and nationally. And then you'll have seen some of this material earlier on today, but we will just quickly look again at the Ipsos survey data. And I'm then going to look at findings from the research that's been published in this field and then go to the summary and the implications. Now, you might think that raising awareness is fairly straightforward. You put the knowledge out there and people will make what they will of it, and that's the job done. But actually, in this field, it's really difficult, because thinking about serious illness and thinking about death and dying touches into our most existential fears, and therefore we prefer not to do it. And I really like this quote, which the president of the Irish Human Rights Commission, Maurice Manning, used in his keynote address to the first forum of end-of-life care in Ireland in 2009. Death, like the sun, cannot be looked at steadily. So even me, who works in the field, I don't really want to think about these subjects on a daily basis. And that will be true, I suspect, for most of you. Helping people look steadily at palliative care really provides them with the pathway to palliative care. It provides them perhaps with the key to understanding and to action that can help them and help others in their community. Now, this slide summarises, I hope, why it's important to raise awareness of these issues. And you'll have already heard that we're facing changing patterns of illness, ageing, and dying. And we're living longer with things that can be alleviated by palliative care. But if you don't know about palliative care and you can't ask for it, then you're never going to be able to access it. And we've also heard that in the last few years there's been an increased interest in the links between palliative care, social justice and human rights, right up to the level of the WHO. But the way in which countries interpret that language of human rights and whether or not they will actually embed the idea of a right to palliative care in their strategies is variable. So we have to empower people to ask for palliative care. And lastly, and I was very deeply moved, as I think the rest of you were this morning, to hear from Jim, palliative care involves social, economic and personal challenges that stretch far into the future. And so having the knowledge and the understanding to deal with those issues is imperative. This slide identifies those stakeholder groups for which public awareness of palliative care is of particular relevance. And of course, the biggest stakeholder group is the public. But we're all members of the public. The groups intersect in complex ways, I believe. Internationally, there's been a large number of campaigns which involve at least some attempt to raise awareness of what might be broadly called palliative care issues. One of those is perhaps one of the most famous ones is the Project on Death in America, which was located in the Open Society Institute and funded by George Soros. It has been the subject of an evaluation, but its impact on quality of care has been difficult to assess. In England and Wales, the Dying Matters campaign, which tries to enable people to talk about their end-of-life care wishes, has been running since the launch of the first end-of-life care strategy in England. And in Australia, there's a Dying to Know Day. Now, you might see that actually the attention to death and dying is slightly paradoxical, because palliative care is not just about death and dying. And this is perhaps a limitation of those campaigns at the top of the slide. Perhaps of more interest for our purposes is the wide-ranging public awareness campaign that was launched in Ireland as part of the All Ireland Institute. And they have a palliative care week which aims to raise greater awareness and deeper understanding of palliative care across the whole island of Ireland. And this is the advert that they have for the Palliative Care Week, which has just occurred in Ireland. And if you go onto their website, you will see that they have some really simple and clear messages about palliative care, which are broader than just a concern with death and dying. I feel on slightly shaky ground when I'm coming from England talking to Canadians about Canadian campaigns, but I will do my best. And here are three that I was able to find. Now, we just saw that lovely film from the Canadian Virtual Hospice. And it's not a campaign in the normal sense of the word, but I think it plays a really important role in as a tool for any campaign that you may wish to organise here. It's been online since 2004 and aims to provide a reputable source of information for clinicians as well as the public and families going through these issues at the moment. The Just Ask campaign is focused on goals of care planning, and while it's targeted again at a clinical audience, it is accessible by members of the public. And the Speak Up campaign is part of Advanced Care Planning in Canada, a larger initiative, which in turn sits under an organisation called the Quality of End-of-Life Coalition in Canada. So there's the Speak Up campaign website. I'm just going to very briefly look at the Ipsos survey data. Some of you have seen this morning. And what comes through most clearly for me is that Canadians really reflect public opinion around the rest of the world about these issues. So around about 58% of people say they are aware of palliative care, but very few are very aware. And you can see the other levels of awareness there. Advanced care planning is something which has been relatively recently introduced, and awareness is still at very low levels there. It's really interesting to note, isn't it, that people tend to get their information via word of mouth, and this draws attention to the importance of stories and exchange within communities, and will be something that I return to later on. The incidence of having written an advanced care plan is very low amongst the survey respondents, but you're much more likely to have written an advanced care plan if you are planning to give care or are caregiving now, are older, have a postgraduate degree, a higher income, know someone who's received a palliative care, or say that you are aware of palliative care. So these two things are very, very tightly linked. Although respondents to the survey had many, many questions in common about family caregiving, the fact that you in Canada, and it's unusual, we don't have this in England, have compassionate care benefits. Very few people were aware of these. And again, the same factors seem to relate to awareness as to relate to having an advanced care plan. I'm now going to turn to the findings from the research that I looked at. And what's interesting from this is that on the whole, the national campaigns that I mentioned earlier have usually not been the subject of any evaluative research. And the Irish campaign is the one exception there. The research that I found relates to discrete planned interventions in one local or several local communities, but I think it does give you some insight into the type of things that could be scaled up or transferred. And I looked at the research according to 4 questions that are on the slide here. So first of all, looking at techniques effective in raising public awareness and promoting engagement in general health, and then funneling down to palliative care, advanced care planning, and then trying to identify what it is that successful campaigns do. So first of all, looking at techniques effective in raising public awareness and promoting engagement in general health issues, there are usually several distinct techniques used in combination to raise awareness or promote engagement in health issues. So healthy eating would be one good example. What's notable is that short mass media campaigns, and I mean short in terms of time, appear to work quite well in changing people's behaviour and influencing policy making. And there's also some evidence that those types of social marketing campaigns can help people make better use of healthcare services. So accessing screening might be one really good example. But the type of media and the apparent source of the information is really important. And in Canada, an evaluation of TV adverts about health promotion aimed at older adults showed that older adults were generally distrustful of the information if they thought it had come from politicians or the government. They were much more trusting of doctors or celebrities like Olympic stars. And here's a picture of our royal family promoting a campaign about mental health in England, which has been really quite successful. It's also really important to use mixed media, the radio, newspapers, TV, as well as all the new media. Younger people prefer new media, while older people, myself included, prefer the old media. And this is a cohort effect that will change over time. Of relevance to our conference, a Canadian study of public deliberation methods where citizens are brought together to learn about, debate and discuss an issue found this is very effective in enhancing understanding of contentious ethical or social dilemmas. And of course, e-health and social media are really increasingly important, but there may be unintended risks and consequences of social media that we don't yet fully understand. These might be termed the sort of darker side of the internet, if you like. So I'm going to look at question 2 now. What techniques are effective in raising public awareness of palliative care issues and helping people talk to their families? And I'm going to start by showing you a diagram, and it comes from a paper by some British researchers, and it captures the continuum of raising awareness through promoting engagement with palliative care. And what the authors argue is the research that falls at the empowerment end of the continuum are much more likely to lead to improved quality of care and well-being. Now, this seems to be a really reasonable hypothesis, but actually we don't have a lot of research to show this yet. And I think that's because projects to show long-term change are expensive and difficult to conduct. Looking specifically at what helps people talk to their families about palliative care issues, most of the research that seems to be effective falls at the empowerment end of the spectrum. And one of them was a project that I led over a period of 10 years or so in England, which was about peer education. And it was peer education for end-of-life care planning, and it involved small workshops, training, and co-writing of materials by the people that took part in the study so that they could make sense of palliative care issues in their own terms. And some of the work was part of a much larger campaign run by a national charity in England and as part of the National End-of-Life Care Programme, which was the implementation arm of our end-of-life care strategy. At the information end of the spectrum, the raising awareness end of the spectrum, there are a few examples of large-scale projects with evaluations of their impact. And I think I'll talk mainly about the Irish evaluation because there they found that radio had a really good reach into rural areas, and I think that's important for your purposes. And I remember Karen saying that she was on the radio this morning. That does appear to have really good reach. Other key messages coming through from the research are the importance of capitalising on media events and stories. And in the British press, a palliative care doctor has written very movingly a fabulous letter thanking David Bowie because his death had enabled a conversation between him and a patient about her wishes for end-of-life care. The third question I looked at is, what are the best ways of raising awareness of advanced care planning? What works here? And you'll have heard that advanced care planning is a process of thinking, talking about, and if you wish, recording a statement about your future end-of-life care. And there's a large amount of research now that shows that advanced care planning creates a lever for palliative care and can reduce the degree of futile medical treatment that you may have at the end of life and enable treatment to be more in line with your preferences. And early engagement is really important because it means that people can be better prepared for the sorts of decisions that they may be faced with when they're ill. And it can also ensure that their family and the people caring for them are more aware of what they would wish if they can no longer make decisions for themselves. And some key messages come through the existing research that are summarised on this slide. The top line message is the importance of being aware that one size does not fit all, and that advanced care planning can mean different things to different communities. So it's really important to co-write materials, to consult about the preferred modes of engagement within communities. And there's one very detailed review of Canadian interventions that highlights the importance of paying special attention to some groups. So frail older people might be one really good example. One of the problems with some advanced care planning projects is that they miss the boat to some extent. They all start when people are ill or when people are older. And there's now a trend towards involving and educating much younger people so that they're better prepared to deal with the issues in their families and communities and in their own lives. And lastly, it's particularly the case, I think, in the advanced care planning literature. There are examples of how communities can be empowered to engage with the topic at a much deeper level than just the level of knowledge. Some of you may have heard of the Respecting Choices advanced care planning programme, which was designed in the USA. And an essential element of that programme is an integral aspect of raising community awareness about advanced care planning. And all sorts of community-based projects are reported in the literature, from those focused on helping people talk about palliative care or understand advanced care planning, to projects with a wider purpose. And Kevin talked about some of these. They're known as compassionate communities, which seek to enable communities to learn about palliative care and then develop their own solutions from the bottom up. And the way in which they do that is through partnership with professional agencies. So compassionate communities are often seen as a socially oriented alternative to medically led models of palliative care, although I would prefer to emphasise partnership there. You can't have compassionate communities without professional expertise. Now, if you look at the research, you can begin to see why it is that community-based projects work. And this slide summarises what I could find about the mechanisms by which these community-based projects work. Social capital simply means enhancing local networks and resources, while critical consciousness was a term coined by a Brazilian educator in the 1960s. And what he was doing, he was referring to methods of education that enable people to translate knowledge into deeper understanding and action, so it has a liberatory function. Many communities now emphasise the importance of seeing palliative care as a wider project to promote general health and well-being. And the term health-promoting palliative care, again used by Kevin in his talk, was first used in Australia by Professor Alan Kelleher and colleagues. And its principles have been taken up in England by the leading public health agency. And the next slide, it's rather busy, I'm warning you, shows how they've conceptualised this in their approach to end-of-life care. What you might want to note is that health is not just the absence of disease, and health promotion for them necessarily involves community engagement and education. And I think this seems to be a really valuable theoretical framework for this whole area. The last question I addressed was, what are the key features of successful campaigns? And I was very lucky because I found a high-quality review of this issue commissioned by the European Literacy Policy Network, which identified key characteristics of successful awareness-raising campaigns in health. And I've tried to capture some of that on the slide here. So one of the things that successful campaigns do is that they align themselves to policy goals. And the second thing that they do is that they monitor and evaluate. And you might remember that I mentioned that some of the campaigns that are in existence have not tended to do that. So evaluation and monitoring is really important. And the other thing I would draw your attention to is the importance of identifying target groups, because one size doesn't fit all, and that you should set goals. And I can never remember what SMART means, but I'll read it out to you now from my paper. So the SMART approach means that the goals should be specific, measurable, achievable, realistic, and time-bound. And I think you can see the rest of the information there, hopefully. So I'm moving now towards the last few slides, and I'm going to try to give you a summary. And I think the top-line messages in response to the question that I was asked to address are as follows. So public awareness campaigns are effective in palliative care and advanced care planning, and they probably also improve the quality of care, but evidence is lacking on this particular point. And short awareness campaigns at a national or a larger level, combined with community engagement, works, but you can't have one without the other. And planning and evaluation are absolutely essential. And I put a quote there from John Dewey: "A problem well stated is a problem half solved." So, bearing in mind that I think that the national awareness-raising campaign is the coach and the community-level campaign is the horses, let's just have a think for a minute about what makes a good national campaign. Well, planning and evaluation, short interventions with really simple messages, and I would commend the Irish campaign to you to look at some really good simple messages. And then piloting and clarity. I was saying to Conrad before I started this talk that I think one of the strengths of your work in Canada is that you actually have a decent set of definitions. In England, we have had all sorts of problems with what palliative care means, and it seems to mean different things to different people, and that has got us into a great deal of difficulty. The other thing that's really important is mixed media. You have to appeal across all age groups and into communities that don't necessarily use the internet. So the radio, for your purposes, will be really good. And the other thing I think that's important is that you need to avoid selling a particular stance. So for everyone in this room who's happy to talk about death, for example, there'll be a lot of other people who are uncomfortable about it. So you must try not to sell a particular stance or to stereotype individuals, because everyone's different. So let's look now at what makes a good community project. Well, again, planning and evaluation. But here, what you're trying to do is, rather than just raising knowledge and awareness, you're trying to build social capital and give people the keys to the door to palliative care, that critical consciousness by which they can take action for themselves. Awareness of special groups is really important. And the other thing that comes through really clearly is the importance of using stories and arts and humanities. And I had the pleasure yesterday of taking a walk across your Alexander Bridge and going to the History Museum. And I was very struck that some of the ethnographers who did that marvellous work on your Aboriginal communities, the way in which they gathered their evidence was just by sitting and talking to older people in those communities. They gathered their stories, and I think that's something that we need to do here. And then the last thing is to address barriers in your local community, and they will be different for every area, I think. I don't know whether you're a diagram kind of person. I'm not sure that I am, but I've tried in this last slide to capture the key messages from my talk. So what I've done is tried to show you the different necessary elements in a successful campaign. It shows the importance of locating campaigns within a framework of public health and the relationship between and different orientations of national and community projects. And it summarises, I hope, the key things to take account of in planning and delivery. Thank you very much.
Thank you very much, Dr. Seymour, for a very informative presentation, not only the evidence that you reviewed, but the very practical advice that you offered for planning and other aspects of effective public awareness campaigns. A couple of announcements before we move into the question period. First of all, we will be presenting some poll questions to you during the balance of the conference. And during the breaks, you'll see these questions on the screen next to me. The screen includes some very specific instructions on how you can participate in the poll, and we will report back to you the results of each poll following the break. So I'll leave that with you to ponder, and you should see the first question at our afternoon break. The second thing I wanted to mention just before we get into the questions is that there will be at least one question asked in French in this next session. There are interpretation devices that are available on your tables, and you're welcome to use those if you wish. Dr. Seymour, you're very welcome to answer in English. And for those of you that are watching on the web stream, we will switch over to an English audio feed for the answer as well, so you'll be able to hear the answer in English. So with that, I'd like to turn the questions over first to the panel and to Don.
Thank you, Fred. Following the pattern that we established this morning, the key group that studied this question will lead off with the questioning. And Ahmed, you have the first question.
Just before I start asking my questions, I'm going to take a kind of a different cultural approach by putting my right hand on my heart, expressing on behalf of all the panel members for these insightful articles, but also paving the road for us to take a journey for deeper understanding of these great questions that you provide insight to us. And thank you so much. Our question, the first one, actually, it's kind of a two-folded. As the question itself, it offers that how the public awareness campaign could influence the quality. We are not yet clear about that, how this is going to impact the quality. Would you like to elaborate on this one? But the second part of the question is that it's going to accompany a short story from one of my colleagues on the panel, as soon as I finish the questions, we know that there are certain imbalance between what is known as the demand and also the supply. Like, we know that there isn't enough infrastructure, there isn't enough human resources, there isn't enough fundings. But this imbalance of the supply and demand, when the awareness, as you were mentioning in your article, that may raise some risk of expectations, how is going to influence this? The reason why we are asking these questions, we would like to share a story with you. Hopefully it kind of verify your questions. I'm going to ask Ghislaine, to present that story.
I'm going to speak in French. You may want to use your headset if you don't understand.
Someone at the back would just hold up a hand. English is on which channel? Channel 1.
English is on the first channel, so if you're hearing this, you're on the right channel. This is your interpreter. Okay, so here is my question. On the other side of the Ottawa River, there's a palliative care center in which I work, where I'm involved. Last year, the center received 750 requests for a palliative bed and only was able to welcome a third of that number. And all this happens at the time when we're hearing that only 50% of the population in Quebec knows about palliative care. So we're wondering if, after a successful campaign of awareness raising with the public, if that number couldn't explode and therefore creating even more problems in terms of supply of palliative care beds. So we're wondering if the supply of palliative care will follow the demand in those circumstances. Would awareness-raising campaigns of the public in other countries had success, could inform us? Did we have similar results? Or what were the solutions there? Thank you.
Thank you very much indeed for those questions. I'll talk first of all about the impact on quality of care, because you're quite right, that is an elusive question. And from the evidence that I had in front of me, it's not yet clear that raising awareness will necessarily and in a linear way improve quality of experience. But I think that what raising awareness will do is enable people to access palliative care at an earlier point in their illness. We already know that if you raise awareness and engagement with advanced care planning, so that's a bit more of a narrow category than just palliative care, that does lead to better care. It leads to better care at systems levels, and it also leads to better patient and family outcomes. So it's in that area, really, that the best evidence exists at the moment. But I really believe that empowering people to understand and to work with this material in their own terms will enable them to ask for palliative care at an earlier point in their illness, because what happens otherwise is that people only become comfortable with the subject perhaps late on in their illness, or they never become comfortable with it. And so their experience of a final illness is imbued, if you like, with an extra layer of suffering because of the discomfort of talking and engaging with the topic. So although the hard evidence is lacking, I think it's self-evident that one must work with this material. The demand and supply imbalance and the very vivid story that I think will be repeated around the globe about what do we do about the scarce resource that is specialised palliative care. How can we make the experience of serious illness and death and dying better for everybody, even if they don't access specialised palliative care, is a really, really important question. And I think the reality is that in most developed countries, and certainly in resource-poor countries, we're never going to have enough specialised resource. So then you have to think about palliative care being something broader than just the specialist resource. It has to be a palliative care approach that not just healthcare professionals and social workers, care workers have, but also families have. Because actually, when you're ill, the people that look after you are your family. They are the ones that provide the palliative care. And if we can enable people to think about and understand palliative care, then we can really help them to do that. It may not be perfect, but we have to try. But I think it's important to understand that palliative care is something that flows through the system. It's not just a specialised resource.
It was brought up earlier in our discussions that we live in a death-denying society, and although the research shows that public awareness campaigns do indeed raise awareness about palliative care and end-of-life issues, I'm just wondering if there's any research pointing to public awareness campaigns actually changing people's perceptions, changing the culture to better enable public awareness campaigns' efficacy.
I'm trying to rack my brains about the detail there. I think it's interesting, just to come back to this death-denying bit, I'm not sure that's totally true, actually, because when you think of any film that you might watch, any newspaper, any magazine that you pick up, then certainly violent death or exciting, sexy death is paraded across the media all of the time. It's just that we don't really like to think of the more mundane day-to-day experience that all of us will face, whether it's caring for an elderly relative or facing it in our own lives. We're less comfortable with that material. So I don't necessarily think we're a death-denying society. We certainly live as if we're never going to die, and that's part of the human condition. I think cultural change comes from those community projects that I was talking about, and that you can edge towards a situation where you can perhaps look at the subject with a bit more steadiness. But people will do that in their own way and in their own terms. And I often think that you can talk about palliative care issues without always having to remind people of death, death, death. So, for example, advanced care planning can be described as an insurance policy. It can be described as an extra layer of support that Sean Morrison, who we will hear from in the coming days, that's how he would describe palliative care. So if you choose the language carefully, you can avoid those areas where people feel really uncomfortable, I think.
Other panel questions? Serena?
Thank you.
Oh, pardon me.
Sorry, just one more question. So speaking about advanced care planning, you'd mentioned that starting young is something that we should start to consider. And I just wonder if there are any other countries, communities that have these types of discussions embedded within a school-age curriculum. You know, how young is too young? How young is young enough? Where should we start? And if there are any other countries that do engage in these types of discussions at the school level?
Obviously, I'm most familiar with the English scene, so I'll talk a little bit about that. And I can't pretend that this is particularly widespread, but what we did in England as part of the so we had a national strategy, but we then had an implementation programme, and the two were linked but separate. Unfortunately, we've now got into a state where, like the rest of the world, we're in economic crisis, so the implementation arm has kind of withered on the vine to some extent, which I think is a moral tale and a worry. But what the implementation arm did was that it worked at a local level, sometimes quite large areas, to work out how projects could be enabled that would cover the goals of the strategy. And going into schools was one of those things that happened. And you might want to look at the work of St Christopher's Hospice in London, and I could put you in touch with the people there if that's of interest and help, because they have a school outreach programme. And sometimes it's just a case of getting the children to come to the hospice and to talk to some hospice day patients and maybe to do some artwork with them. So not necessarily talking about advanced care planning per se, but making the children feel comfortable with illness and with aging as well. And then maybe that opens the door to talking about, well, how would it be for you later on in your life?
All right, we have Serena, we have Penelope, and we have Ken. So, Serena.
Thank you for your presentation this afternoon. I tend to draw upon the word praxis in thinking about action and reflection. And I was thinking this morning about what Kevin shared with us about, the vigilant communication. I wonder what the correlation is to our public awareness campaigns and recognizing in our survey results that Canadians want this to be cost-effective and responsible. Do we take the opportunity, and do you have any kind of insight on how we can ensure that we are thinking about those unintended consequences that you spoke of? And I think, again, from the analysis that are we ensuring that we're inclusive of minority groups here, our Indigenous population here? Is it reflective of socioeconomic? I mean, what does our public awareness look like, and how does that translate, and where do we get into that vigilant communication to see how this is translating for people?
I think you've already made a start, really, in the way that you're approaching this and in having a steering group and carefully constructing your lay panel. And I would suggest that if you're going to develop an awareness-raising campaign at a national level, you would design and plan it in a similar way, and that you would pilot the materials and make sure that you can translate them easily into your national languages as well, and perhaps the languages of the Aboriginal community. I think one of the messages that came through from the research is that simple is really, really important, but sometimes to get things to be simple, it requires a great deal of work and consultation. It also requires, I think, a lot of collaboration across people who might not naturally be good bedfellows. I think one of the problems in England is that lots of people have jumped on the bandwagon and they've all tried to do the same thing, whereas if they'd worked together, it would be A, cheaper, and B, much better. and would achieve something far more important. We haven't had this kind of consensus meeting, and I think it's a shame that we haven't. So work together, keep it simple, keep it short, but then allow things to grow more organically in the local communities. See how they take up that material and see what they do with it themselves. That would keep the costs down as well, I think.
Penelope?
There's been a lot of talk of family caregivers, but we see the structure of society changing in developed countries, including Canada, with more unmarried people, more people without children. And I just wondered where you see care for these people coming from under this structure.
Yeah, when I use the word family, I don't necessarily mean, the 2.2 children. I mean the people who are close to you, and that. But there's all sorts of diverse family forms. But yes, I think you're absolutely right. The increase, particularly in older people who are living longer, perhaps with no family at all, and who are suffering repeated death of their closest friends, is very, very, very challenging. And Jim said this morning that we need to widen our idea of what family is. I'm particularly concerned about what happens to older people living alone in terms of their nursing and personal care. And we often don't talk enough about the physical bodily needs that people have when they're ill. And that's something that we need to consider. That perhaps ranges a bit outside of my topic. But if you're going to be fully informed as a carer and as a community that cares, you need to know about these things.
Thank you.
Ken?
Thanks. That was a great presentation. I want to pick up on this, or get back to this question of death, because on the one hand, I don't think it's a universal experience, and different cultural groups experience death differently. Mm-hmm. There's a different understanding of death, and I appreciated your nod to ethnography, partially because that's my background. And there's a substantial research literature on the anthropology of death and dying that describes that the very nature that death is a different experience that I think could, in very many ways, be built into a communications campaign around palliative care, which leads me to it's partially a question, partially a statement, I suppose. Can we really separate out death from discussing palliative care? And you raised in your presentation the building of palliative care campaigns around or in relation to other general health campaigns. And what I've started to think about is, should we build palliative care campaigns around their consequent sort of relation of birth, because they're both social events. Death is a social event, and birth is a social event. We understand in our society birth to be a celebratory kind of cultural phenomena with that meaning, and assign it, probably not enough, but substantial resources as a function of that. We don't understand death in the same way. So I wonder, in terms of communications, if we'll ever get the resources to support a social process and a social event of death and dying in the same way that we support birth. And I guess the question I'm asking you, based on your experience, is, can we get to that point? Can we get to a point where we can use communication strategies successfully to sort of start a process of a change in cultural understanding of death along the road to building better palliative care programs?
That was certainly the underpinning sort of hypothesis, if you like, of the Dying Matters campaign in England. And I have to come clean and admit that I was never in favour of that title for their campaign. Partly because I think that we do need a new model of palliative care that emphasises not just the dying phase, but the earlier phases as well. And I felt that it emphasised and focused attention on the dying phase. I think that, yes, you probably could use social marketing to enable people's comfort with talking about death and dying, and that was certainly the raison d'etre of part of the project on death in America, and you might want to look at that as well. But I firmly believe that if we're going to communicate to a large swathe of people and actually develop a model of palliative care that's fitted to the 21st century, it needs to be broader than just talking about death. Death's always going to be in the wings. It's always there. I mean, it's the way that if we didn't have death, there would be no meaning to our life. So it's always there. But I don't think people necessarily wish to have it pushed into their face all the time, and it could turn them off seeking the help that they need to get. That's my worry.
One quick question, one more.
My concern would be, though, that isn't palliative care the strongest domain to be able to talk about death? And probably, we've challenged is more about the dying that people are phobic about, right? So my concern on changing that discourse and the labeling of that too much is that we will lack the congruence that I think is necessary for us to have these difficult conversations.
Certainly you need to have those difficult conversations once people get into palliative care. Once they need palliative care, you need to be comfortable. But in terms of the public, I think a broader platform is important. Of course you need both. It's the balance, I think, that's important.
And that is our time, Fred. Back to you.
Thank you very much, Don. So ladies and gentlemen, we do have a few minutes remaining if there are questions here in the room. Or again, if you're watching through the webcast, please let us know if you have a question, and we'll be pleased to ask it on your behalf. Yes.
Hi, my name is Siham Rabba, and I'm with Accreditation Canada. Dr. Seymour, my question for you has to do with the definition of selling. You said that we should avoid selling, and I ask this simply because my background is both from a salesperson perspective and a research person's perspective, where as a researcher I worked in both an academic and non-academic settings. As a salesperson or saleswoman, my training is based upon the principles of conducting a needs assessment to understand your client or your population's needs, to address their concerns so that way you can customize a solution, and to educate so that way you demonstrate value in the solution. Given this and what we were talking about in terms of building awareness, to me, that is selling. So I was hoping if you could explain a little more about what you mean by not selling.
Yeah. You need to forgive me there, because I think that the slide presentation and the need to condense meaning means that sometimes things are a little misleading. I think what I meant was that you, in trying to educate people about palliative care, you need to be pretty neutral and pretty balanced, rather than selling a particular solution or a particular stance. So I'm in favour of social marketing, which of course is selling. I'm not in favour of selling a narrow solution. I think that's what I meant. But thank you for your question.
So essentially the part that omits the needs assessment to understand your population's issues and concerns.
That's all really important, yeah.
Thank you.
And in fact, is on one of the slides I put the factors for successful campaigns: target audience, planning, getting your messages right. That's selling, I think, from your point of view, isn't it?
Yeah. Thank you.
Thank you.
Sharon Baxter, please.
Hi. So CHPCA has done a number of these campaigns. So the Advanced Care Planning in Canada is done by us. And we have a national awareness campaign in the spring and the fall, and we're just ending a month of action campaign. And our struggle is that we don't have very much money to do this, so we reach out to the same 6,000 people instead of the 34 million Canadians. So it's one of those struggles. But one of the things we did last year was we actually took the campaign and made it around the palliative approach to care. So about talking to Canadians about what this is. And we know from the homemade thing, and your from England, so I'm not sure that you know about our medical aid and dying issue, but we know that Canadians are really confused about do not resuscitate, sedation, what euthanasia, assisted suicide, what palliative care, what a palliative care approach. It's all muddled up in their minds. And so I just wanted to say that I agree with the bulk of what you're saying. We really need to tackle this, and we really actually need to tackle it soon. And it's not about specialist care, palliative care, and selling. It's about talking to Canadians about, what their rights are and what they have in front of them. And, it makes sense for us to do this. But our struggle has been not having the desire and the wish, but just being, restricted by our reach. So I think that it's something for us to take into consideration. But we have some models in this country. I just wanted to make sure that we pay attention to some of those.
Absolutely, and I think that just use what you've got, but collaborate together and perhaps do some sort of a scoping review and see if any of those materials can be reused and look internationally as well.
The Quality End of Life Care Coalition is one of our partners, and it has 38 national groups, and many of them are in this room today, CPAC and Palliative and CVH, and a number of them. So I think that what we have is a really great coalition of 38 very strong CMA, CNA, so if I forgot you, you're in there. We're all members, but to actually coordinate our effort, to actually do it together, and we have taken on a lot of social media, but again, we could do much better if we were actually a bit more planning and a bit more resources to do it. But I think we're on the right track, but just wanted to lay that out.
Yeah, absolutely you're on the right track. I think it's very impressive what you've been doing. Thank you for your comments.
Thank you all for the questions. And before we move on, I'll just ask, Mr. Chair, is the panel satisfied? Right? Very good. Please join me in thanking Dr. Seymour.
Thank you.